The face and neck lift is an important portion of the facial rejuvenation process. There are many different techniques that are available for facial rejuvenation and facelifting. Each of these techniques has different nuances and basically is reserved for each type of patient, meaning there is not one technique that I use on all of my patients. Okay? Each patient has a different need and will require certain different subtle modifications. What I can tell you is I get approached by multiple patients about getting something like a lifestyle lift or a lunchtime lift or a weekend facelift. What I can tell you is I've seen those patients post-operatively. Their lifts are not durable. They come back to me a year later and they need to have everything redone. So what's being done is not as effective as what we can be doing, and that usually involves a full face and neck lift. To do a full face and neck lift, you have to have a legitimate high-end surgery that requires a significant amount of skill and in my hands takes a fair amount of time. To do this, we have to make real incisions. Typically, we have to make at least an incision in front of your ear that goes into your scalp, and then we have to curl behind your ear and sometimes into the posterior part of your scalp, the back part of your scalp behind your ear. I often will make a little incision under your chin also. And what we do is we try to release the skin and free it up and then get to the deeper underlying structures, which is the fat and the muscle layers, and tighten those muscle layers to reposition those where they need to be. And then we tighten up the skin, but I don't like to pull the skin back. For me, I like to pull the skin up and superior because that seems to be the more natural appearance. What we really want to avoid is an unnatural looking facial rejuvenation. No one should look at you and be like, whoa, he or she got a facelift. They want to look at you and say, wow, that person looks really good. That person looks really awake and alert and just looks youthful. And there are a lot of different things that I do to help myself when I'm doing a facelift. I often do a full neck liposuction also. And one of the other things that I do, as well as other facelifting surgeons will do, is actually add back volume into your face. And what I mean by that is you actually do liposuction in areas where you don't want fat, like the tummy, and you do fat injections, very small quantities, into areas of the face to help fill the face back up. Because it's not only pulling tight, it's a lift and fill that helps your face look more youthful and rejuvenated. Places that we will add fat typically are in your cheeks, sometimes in your temporal area here where you can have some hollowing, sometimes in the folds right here, and sometimes in the lips. We also can add small amounts of fats under the eyes here to kind of get rid of that hollow area under the eyes. Thank you very much.